what is wrong with this bill, what is wrong with the Mikulski Amendment, is we rely on government bureaucracies to make the decisions about care rather than the trained, learned, experienced, truly caring caregivers in this country to make those decisions. And instead of going after the fraud in Medicare, which is well in excess of $90 billion a year, we've decided we'll ration care. And the authors of this bill are going to say, no, that's not true. But when I offered amendments in committee to prohibit rationing of Medicare services, to prohibit it, it was voted down. Every person who is sponsoring and voted for moving on this bill voted against the rationing. Now, why would they do that? Because ultimately, the feeling is we know better. Washington knows better. We know your patients better. We know how to practice medicine better. We're going to take ivory tower doctors who don't have real practices anymore. We're going to take retired researchers, and we're going to tell you how to practice. And we're going to save money by limiting what you can get. Now, the chairman of the Finance Committee has said we don't truly cut Medicare Advantage, that the services aren't reduced. Well, your own bill on page 869, subtitle C, Part C, I won't go through reading it, reduces Medicare Advantage payments. The differential from $135 a month to $50. I'll read it to you. I'll be happy. The chairman's shaking his head. Let me read it to you. And here, let me also reference what CBO has said. I'll be happy to yield to you if you want to talk now or you want to let me finish.
Page number, yes, I'd like to ask you a question.
I'd be happy to yield to the senator.
I think I have the page number here. What page was that?
869, subtitle C, provisions relating to Part C.
Okay. Now, I don't have it with me right now, but there's no required reductions in fringes or extras. That's all we're talking
There's no required reduction in what, sir?
Fringes, like gym memberships and extras like that. The bill basically provides that there be no reductions in guaranteed Medicare payments. There's a long list of what guaranteed Medicare payments are. And even the Medicare Advantage companies, which are private companies with officers, and they've got stockholders, and they've got to report to their board of directors, and they've got all these administrative costs and so forth. They're very huge admin costs. The reductions to Medicare Advantage are still that is the application of the reductions to Medicare Advantage plans are at the discretion of the officers. So there's nothing, the officers can decide that they're not going to cut the fringes. That is, the fringes and the extras that are beyond, in addition to the guaranteed Medicare benefits. So if an officer wants to, it's his discretion. I'm assuming it's
I would reclaim my time and ask to submit for the record CBO Budget Office Estimate 1121-2009, which shows an average from $135 down to $51 per month on the average Medicare Advantage beneficiary. The fact is if you like what you got, you can't keep it for 2.6 million Americans. You can say that isn't true. That's what CBO says. Here's their numbers. They sent the report to you, Chairman.
If it's federal yield?
I'd be happy to yield.
It is true that the reductions in, first of all, let me just back up. Isn't it true that the MedPAC Commission, it's their conclusion that the Medicare Advantage plans are overpaid?
Absolutely. I agree with you.
Is it also true that it's our recommendation that Medicare plans are overpaid by amount of about 14%?
I don't know the actual percentage, but I would agree to you that they are overpaid.
They're overpaid.
Yes, sir.
And if they're overpaid, well, doesn't that necessarily mean there'd be a reduction in payments attributable to each beneficiary?
No, it should actually.
By definition.
I disagree with that.
Well, if they're overpaid, and if they're
here's what I would say. This morning, the claim made by you and Senator Dodd is that Medicare Advantage is not Medicare. Medicare Advantage is Medicare law. It was signed into law. It is a part of Medicare. You would agree with that?
Oh, absolutely.
Okay, Medicare Advantage is a part of Medicare.
In 2003, I made a mistake and agreed to give the Medicare Advantage plans way more money than they deserve. And as you said, that they're overpaid.
I agree with you. You won't hear that from me. Now, how'd we get there? How'd we get there? How'd we get there to where they're overpaid? We had an organization called the Center for Medicare and Medicaid Services. They're the ones that let the contract, aren't they? They, in fact, are. And 25% of the overpayment has to be rebated to CMS today. You would agree with that? 75% for extra benefits, 25% rebated. How'd we get to where they're overpaid? Because we have a government organization, a government-centered organization who was incompetent in terms of how they accomplished the implementation of that bill. And what was said by Senator Dodd this morning, and I confronted him already on it, but it bears repeating, is the Patient's Choice Act eliminates the dollars without eliminating the services, because it mandates competitive bidding with no elimination in services for Medicare Advantage. So if you really want to save money, competitively bid rather than go through 8 pages of reductions by year in the payments that go back to Medicare Advantage. So we have this complicated formula that nobody who would listen to this debate would understand. I know the chairman understands it because he helped write it. The fact is 2.6 million Americans, according to CBO, will see a significant change in their Medicare benefits. Medicare Advantage is Medicare Part C. We've had a kind of a differential made that it wasn't really Medicare. It is Medicare. And 20% of the people in this country that are on Medicare are on Medicare Part C, Medicare Advantage. And they like it. And why do they like it? Because most of them don't have enough money to buy a supplemental Medicare policy to cover the costs that are associated with deductibles and copays and outliers. And so as and I agree with the chairman, I agree that Medicare Advantage is overpaid. I disagree with the way you're going about getting there. But I also disagree taking any of the money that is now being spent on Medicare Part C and creating another program. I think all that money ought to be put back in to the longevity of Medicare. And in case you don't understand how impactful that is, we now owe, just in the next 75 years, actually we don't owe it, none of the senators sitting here will be around. Our kids are going to get a payback $44 trillion in money for Medicare that we allowed to grow, if fraud, $100 billion, close to $100 billion a year. We did nothing about, this bill does essentially nothing about. $100 billion a year, that's $1 trillion every 10 years. That if we were to eliminate that, which this bill does not, we would markedly extend the life and lower what's going to come to our children. Which leads me to the other important aspect of the health care. We know that when you take out the funny accounting, the Enron accounting on this bill, and you match up revenues with expenses, that you're talking about a $2.5 trillion bill. And the chairman of the Finance Committee readily admits he's got it paid for. CBO says you have it paid for. But how does he pay for it? He pays for it for 2.6 million people who like what they got today. They're going to lose what they got today. He pays for it by raising Medicare taxes. And then the Medicare taxes that he raises, he doesn't spend on Medicare. He goes and spends on a new entitlement program. Think about what we're doing. Is there a better way to accomplish what we're doing. And Mr. Chairman, thank you for allowing me the indulgence to continue this long. And I will wind up with just a couple of statements and share the floor with you. You know, after practicing medicine 25 years, I know we got a lot of problems in healthcare. And I appreciate the efforts of the chairman of the Finance Committee to try to find a solution for them. It's not a bipartisan solution, but it is a solution. It's a solution that grows the government, that puts the government in charge of healthcare, that creates blind bureaucracies that that step between you and your doctor. And that's one way of doing it. But wouldn't the better way be to do the following? Let's incentivize people to do the right thing rather than bureaucratize, mandating that how they will do it. Wouldn't it be better to incentivize tort reform in the states? Wouldn't it be better to incentivize physicians based on outcome? Wouldn't it be better to incentivize good behavior by medical supply companies, DME, drug companies, hospitals, physicians, through accountable care organizations, through transparency for both quality and price? We don't have any of that in here. What we have is a government-centered bureaucracy that, according to CBO figures, will add 25,000 federal employees to implement this program. 25,000. If you call the federal government, how long does it take you now to get an answer? And we're going to add 25,000 just in health care. That's an extrapolation, Mr. Chairman, of the amount of agencies dividing what CBO says per agency and per cost that will come up with. Wouldn't it be better to fix the things that are broken rather than to try to fix all of healthcare? You know, I heard one of my colleagues today say on the floor, and I think it's really true. People in America are upset with us, and I think rightly so. I apologize to the American people for my arrogance. I apologize to the American people for the arrogance of this bill. The thinking that we got it right, that we can fix it in Washington, that we don't have to listen to the people out there. We don't have to listen to the people that are actually experiencing the consequences of what we're going to do. The arrogance of saying we can create a $2.5 trillion program and that we know best. Well, you know what? We don't know what's best. And as Senator Alexander has said so many times, what really needs to happen is we need to start over. We need to protect the best of American medicine. What is the best? If you get sick anywhere in the world, this is the best place in the world to get sick, whether you have insurance or not. If you have heart disease or atherosclerotic vascular disease, this is the best place in the world. It costs too much, there's no question, but it's the best place. If you have cancer, you are 1/3 more likely to live and be cured of that cancer living in this country than anywhere else in the world for any cancer. It costs too much. This bill doesn't address the true causes of the cost. What are the true causes of the cost? Well, one, we know Medicare and Medicaid underpay and we get a cost shift. That's $1,700 per year per family in this country. So you get to pay 3 taxes in this country on health care. You get to pay your regular income tax, which goes to pay for Medicaid. And it also is now starting to pay for Medicare as well. You get to pay 1.45%, plus your employer gets to pay 1.45% of every dollar you earn for Medicare. And then your health insurance costs $1,700 more per year because Medicaid and Medicare don't compensate for the actual cost of the care because of the government-centered role that is played in terms of the mandates, the rules, and regulations. We have a tort system in this country that costs upwards of $200 billion in waste a year, 8%. of the cost. 90% of all cases are settled with no wrong found at all on caregivers. And of the remaining 10%, only 3% found anything wrong. So 97% of all the cases, only 10% go to trial. 73% of that 10% are found in favor of the providers. Yet we spend all this money practicing defensive medicine. There's not one thing in this bill to fix that problem. That's 8%. So take your health care premium or your percentage of your health care premium and apply 8%. It's going down the drain because I'm ordering tests that you don't need, but I need to protect myself in case somebody tries to extort me with a lawsuit that I know is going to get thrown out. I have to have it there to prove it. Then we have inefficiencies. Ultimately, what we need to do is protect what is good, incentivize the correct behavior in what is wrong, and go after the fraud in healthcare with a vengeance. Put doctors in jail, hospital administrators in jail. Don't slap them with a fine and ban them from Medicare. Put them in jail. The people that are stealing our grandkids' money, up to $100 billion a year, need to go to jail. We play pay and chase. We pay everybody, and then we try to figure out whether they deserve to get paid. Nobody else does that, but the government does. And that's who we're getting ready to put in charge of another $2.5 trillion of health care. One of the reasons health care is in trouble in this country is 61% of all the health care in this country is run through the government today. And when you look at TRICARE for our military, you look at VA care, you look at Indian health care, you look at S-CHIP, you look at Medicaid, there's an estimate that $15 billion a year in fraud in New York City alone on Medicaid. That's one estimate per year in one city on Medicaid. And then Medicare. And we're going to say those are running so good, we ought to move another $3.5 trillion or 15% of the health care to where we're at 76% of all the health care is run by the government. I reject that out of hand. Until we can demonstrate we're good at what we do, what we ought to be doing is turning it back. The private sector isn't the answer to everything. I agree with that. I can't stand 80% of the insurance bureaucrats I deal with. But at least I got a fighting chance because they'll call me back when I need to do something for a patient. I never get a call back from Medicare. They don't call me back. The state doesn't call me back on Medicaid when I need to do something. So I just go on and do it and find somebody else to pay for it. That's the kind of system that we have today. Think about the mothers in this country in a Medicaid system where 40% of the primary care doctors in this country won't see their children. That's Medicaid. That's realistic Medicaid today in our country. And so they've got a sick kid, but they can't get into a doctor. But they've got insurance. They've got Medicaid, but they can't get in. And why can't they get in? It's because only 1 in 50 doctors last year who graduated from medical school goes into primary care. So we've created an abrupt shortage in primary care. And number two is the payment's not enough to pay for the overhead to see the child. And yet, so you have a weeping woman worried about their sick kid and care delayed. If you can't get in, doesn't matter if you have Medicaid. If you can't be seen. And so what happens? We go to the emergency room. What happens in the emergency room? We spend 3 or 4 times as much as we should because that's an emergency department. The doctor has no knowledge of the child or the mother, doesn't want to get sued, so we have a 40% defensive medicine cost in the emergency room. The answer is not more government health care. The answer is creating the incentives for people to do the right thing. The only way we get things under control in health care in this country, and the only way we create access for people in this country, is to decrease the cost of health care. This bill doesn't decrease the cost of health care. And if we want to make sure we continue what's best with American medicine while we fix what's wrong, what we will do it is one significant part at a time. I can't imagine dealing with thousands, tens of thousands of more bureaucrats in healthcare. And I can't imagine the impact that's going to have between me and my patients. It's going to severely impact them. Do I want everybody in this country to have available care? Yes. 15% of my practice was gratis. People who had no care had no money. And that's true with a lot of physicians out there in this country. It's true with a lot of labs. It's true with a lot of hospitals. It's true with a lot of the providers in this country. They're caring people. And we're going to tie them up. We're going to put regulations and ropes around them. We're going to mandate rules and regulations. And we, in our arrogant wisdom, are going to tell Americans how they're going to get their health care. I certainly hope not. And I'm not thinking about me. I'm thinking about our kids and our grandkids. I'll end with one last point. I say I will. I may not have my notes with me. Thomson Reuters, a study put out October 9 this year, very well-respected firm. Their estimate of the $2.4 trillion that we spend on healthcare per year in this country is that between $600 and $850 billion of it is pure waste. Defensive medicine costs and malpractice is between $250 to $325 billion by their estimate. Not one thing in this bill to address that. Not one thing. Fraud. Theirs is between $125 and $175 billion per year. Not significant in this bill. $2 to $3 billion. Administrative inefficiency. 17%, between $100 and $150 billion is wasted on paperwork in healthcare every year. Provider errors, that's me, between 75 and 100 billion. That's either wrong diagnosis, failure to treat appropriately, do that. It's the smallest of all of them. And what are we doing? We're going to tell the providers, the hospitals, the medical device companies, the drug companies, the doctors, the radiologists, the labs, the physical therapists, the home. We're going to tell them how to do it. That's not where the problem is. My hope is that the American people will come to their senses and say, wait a minute, slow down, stop, fix the important thing, fix the worst thing first, the next thing second, the next thing third, the next thing fourth. The unintended consequences of this bill are going to be unbelievable. Nobody's smart enough to figure all this out. Nobody. Nobody on my staff, nobody on the Finance Committee, nobody in Majority Leader Reid's office can predict all the unintended consequences that are going to come about because of this bill. Mr. Chairman, you've been awfully patient, and I see my colleagues here to offer an amendment. With that, I yield the floor.